Good morning, ladies and gentlemen. I'm Dr. Hisham bin Masoud. I am a family medicine and emergency medicine consultant and IMCI consultant with the UNICEF. Today we'll talk about a new topic. It's called anemia, and it's very common in under 5 years, especially at the age of 12 months. And this topic is considered very important um, as a daily practicing dealing with these cases in the primary healthcare. Uh, the topic title that we are sharing with um, is the assess, classify, and treat, follow up, and counsel for anemia in the age group between 2 months until 5 years of age. This topic is main objective are to assess and classify the sick child complaining of anemia and treat the child complaining of anemia, counsel the mother for anemia, and give a follow-up care for anemia. As we know all, the integrated management of newborn and childhood illness have specific steps going on, and these are fixed. First step is to assess and classify the sick child, then to treat the child. After that, counsel the mother and give follow-up care. Overall pictures of the management child complaining of anemia. Firstly, as we know that the child with the caregivers after passing the reception goes to the triage corner to be seen by the triage nurse. And there, the triage nurse should look for general danger signs. And I just want to remind you about the general danger signs. Is the child is not able to drink or breastfeed, or the child vomits everything, or the child has had a convulsion or is convulsing now, or the child is lethargic or unconscious. If the child have one of these, the child considered and classified as a very severe disease and should be referred to the treatment site or treatment room to have a quick treatment and assessment and refer urgently to the hospital. If there is no general danger signs, we should look for a specific one if they complaint related and look for palmar pallor. The palmar pallor is usually paleness of the skin. It is a sign of anemia. Most see a child has a palmar pallor. Look at the skin in the palm. Hold the child's palm open by grasping it gently for the side, and don't stretch the fingers backward. This may cause pallor by blocking the blood supply. Comparing the color of the child's palm with your own palm and with the palms of the other children, if possible. If the skin of the child's palm is pale, the child has some palmar pallor. If the skin of the palm is very pale or so pale, it is have severe palmar pallor. As seen in this picture, you can see both children have a pallor, and there is a comparison between the caregivers and the other child in one picture at the left side, and the other, which is on the right side. You can see a comparison between it and the caregivers and very severe pallor. Both of these, some or severe pallor, we should have doing a complete CBC count to confirm. So if you have a severe pallor, we should refer them to the treatment room. If you have some pallor, they can wait and go to the examination site. About a severe pallor, as mentioned before, If the result count less than 7 gram per deciliter, we categorize it as or classified as severe anemia and should be referred urgently to the hospital. If at waiting area and have a CBC count and the CBC count it's more than 7, and going to the examination room, the direct physician, there's 2 possibilities. One of these, the hemoglobin level will be between 7 and less than 11, which is called anemia. And the other possibility is when you do the CBC, its hemoglobin is 11 or more, so there is no anemia. So now we're going in depth in detail for assessing anemia. First of all, in assessing the anemia, we should ask has someone has anemia in the family, or there's any anemia running in the family. If yes, what is kind of anemia? As we know that there are some anemias running in the family, like sickle cell anemia, thalassemia, and pharism. All of these can be running in the families. And this is not an iron deficiency anemia, or even needing what we call further investigation that are beyond the primary healthcare facility. Then the second question is there's no another question, just looking for palmar pallor. If there is a palmar pallor, some or severe, we do a CBC count and look for the CBC count. We should, in the scope of this topic, is to look for the iron deficiency anemia, which is very common in this age group. And the iron deficiency anemia have a specific characteristic when you're looking in the CBC. There is a microcytic hypochromic anemia with RDW more than 14. If there is other types than microcytic hypochromic anemia and RDW more than 14, like if it's RDW less than 14, or there is macrocytic hypochromic anemia, in these situations, we don't deal with iron deficiency anemia, and that need another further investigation, which cannot be done in the primary healthcare, should be done in the hospital to look for the cause. But as we know, the most common cause of anemia is iron deficiency anemia, and the most common cause of iron deficiency anemia is nutritional cause. So the classification, again, we classify him if there is a severe anemia, if the hemoglobin level less than 7, or have a severe palmar pallor, or about the anemia, if there is some pallor or a hemoglobin level between 7 and less than 11, if the hemoglobin level between 11 or more, or there is no pallor, there is no anemia. So this classification, I want to remind you, there is a 3 possibility classification for a child with anemia. There is severe anemia, or some anemia, or no anemia. The child with anemia, about the treatment. If the child have severe anemia, we should refer urgently to the hospital. If the child have anemia, refer the child to the hospital if the CBC is not suggested for iron deficiency anemia, or there is a family history of hereditary anemia, and you shouldn't give an iron. If the CBC suggesting an iron deficiency anemia, we give an iron, we assess the child feeding and counsel the mother of feeding, and advise the mother when to return immediately, follow up after 14 days, and if feeding problem, we should have a fixed follow-up in 7 days. If the child have no anemia, the child is more than 2 years of age, praise the caregiver. If the child is less than 2 years of age, we should assist the child feeding and counsel the mother on feeding according to the feeding recommendations. And if there is a feeding problem, follow up after 7 days. About any medications, as we all are familiar with, we should have some instructions to the caregivers about these medications, for example, about the doses and frequency. In addition to that, the formula and giving the reason why we should give these medications, and demonstrate how to measure these doses, drugs in front of the caregivers, and try to make the mother practicing measuring the dose by herself, and also give the first dose of the child in your clinic. It's preferable to do these practices. Also, check the mother's understanding before she leaves the clinics. About iron supplementation, we give one dose 6 milligram elemental iron per kg daily for 14 days. I just want to remind you all that it's proper to give to calculate it according to the body weight, and we give only a 6 milligram of iron, and should be written into prescription by multiplying the 6 milligram by the child's body weight and putting this result inside the prescription. As we know, there is in our market, in the pharmacies, there's many different concentrations for iron, and that make it impossible to put it in the fixed concentration as is written demonstrated in this table as the iron serum 30 milligram per 5 minutes. And from that, I'm emphasizing about writing the doses, total dose of elemental iron, which is given once a day in the prescription. Give a follow-up care for anemia. As said, there is a fixed follow-up after 14 days, and after that we should assist the child again, look if there is any general danger signs, and counseling if there is any other complaints. And after that, we give an iron again. We advise to return in 14 days for more iron, and continue to give iron every 14 days for 2 months. If the child has Balmer pallor or hemoglobin is less than 11 gram per deciliter after 2 months, refer for assessment. I just want to remind you that it's best to not doing a CBC count after 2 weeks. We just preferable to do it after 1 month. And if it's there is a clear improvement in the hemoglobin level, 1 milligram per deciliters, that's fantastic and good, and that is a sign of improvement. In addition to that, we should assist the child's doses. It's given every day, and if there is any side effects coming noticed by the caregivers, and most probably will be the constipation or the black stool, and some have high dyspepsia and make it going vomiting this medication. So we just reassure the caregivers and advise her to continue giving the iron, and it's preferable to give them with foods to make it more easier comfort from the stomach. Counsel the mother for anemia about the safety net. We should advise her to have a follow-up care for anemia if there's any general danger signs, or the child become more sicker or develop a fever. If this is happening, we should return the child again to our clinic and assist him to look if there is any serious issues. About the home care, we advise the mother to have, if it's below 6 months, to breastfeed more frequently and longer duration for each feed. If it's the child more than 6 years of age, recommend feeding according to specific age group for IMCI program. About promotion advocacy, we advice for next willing child visits, to be, if appropriate, for immunization and other screening. Thanks for participation. I hope we see our together again. But I want just to have some wrap-up summary for these presentations. As we all know, the anemia is very common in this age group, specifically at the age of 12 months. So there should be a universal screening for all who are visiting the primary healthcare at the age of 12 months or 1 year, and even if they come well. So we advise, because in our system we have a fixed vaccination at the age of 12 months, we should do it universally for all children at the age of 1 year. And why we do it? Because, as I mentioned before, the prevalence of anemia in this age group is high, reaching 1/3 of the cases, and that's why we should do it. And as we know, the anemia is not only a sign of anemia; it's having many impact on the child's development, either on the general health overall. For example, there is increased chance of dental cares and their development and performance in the school. In addition, we need a healthy child physically and mentally. So we should have a fixed screening for anemia at age of 12 months and doing CBC. But in the other visits, we should have a screening of anemia by pulmonary pallor. If there is some or severe pulmonary pallor, we should do a CBC. Otherwise, there is no indication to do a CBC to look for anemia. Don't forget to ask about any hereditary anemias in the families, running in the families, and especially in our country here, there's different regions have different hereditary causes. Like in the north of Libya, there's thalassemias and I found 1,668 dehydrogenase deficiency, which is called fascism. We in the south regions we have what we call the sickle cell disease, and we it's very important for us to have proper questions at the proper time. The second one, you don't mess with anemia. You should manage anemia and give the proper dose for anemia. The proper dose, as I mentioned, is 6 milligram elemental iron given once daily for 2 months or even more, according to the response. But most of the time, if there is no, we don't reach the target response after 2 months, which is will be 11 gram per deciliters or more. We preferable to refer the child to the secondary level to look why. About nutrition, we said that anemia, most causes of anemia is an iron deficiency anemia, and most causes of iron deficiency anemia in this age-specific group is nutritional cause. So we need to have an assessing the nutrition of the child and looking if there is any feeding problems. It's usually there is a feeding problem, and we need to look for seriously and to manage it. If there is a feeding problem, we should have a fixed follow-up care after 7 days. Otherwise, if there is no any feeding problem, we just have a fixed follow-up after 14 days. remember to to give the mothers uh, the proper instruction for the doses, and to tell her that these medications have some sort of what we call the side effect or adverse events, like constipations or a black stool or some GI discomfort for the child, and should be given with kind of food that make it easier for that child. Remember that is the main cause, the main purpose to give it is to solve the anemia, which have many problems next for the development of the child, and even for the general health of the child. So it is good to have a good counseling with the caregiver about the treatment and the nature of the disease and how to manage it at home. Thank you all. I hope that you enjoy for this presentation. I hope to have a next meeting in near soon. Thank you. Bye bye.